My name is Elizabeth Mills, and I am from Strathroy, Ontario, Canada. This was my first IDF retreat, and actually I'd never really heard about it before. And actually I'd never really heard about immunodeficiency or CVID before, being diagnosed, which I think is the norm with PI. Unless you are directly affected by it, you tend to really not know about all these rare diseases. But yeah, I highly recommend this retreat. It has been fabulous. I've made so many friends and got to know so many people that are experiencing life the way I have the last 3 years and more. My symptoms started when I was 2 years old, and it was just stomach problems, So doctors went through the list, dairy allergies, and so on. So my parents really struggled with me and all these stomach issues that I had from a very young age. Weight gain, weight loss, unexpectedly, not really any reason for it. Loss of appetite, gaining appetite, it was just kind of back and forth with me growing up. And my parents really struggled with saying, my child is sick, this isn't normal. And doctors just being like, not really looking any deeper than, like they say with the, you hear hoof beats and you think a horse, but you should be looking at the zebra, and I feel like that's me growing up, it was always the horse, what's the most obvious thing? Well, that must be what she has. So it wasn't until I got into my 20s and got married and had a child that I really started to become my own advocate, and started to realize, I don't have to live like this anymore. Maybe I should really start to be proactive with my health and not accept, just being sick every day. Maybe I should do something about it. And fatigue, just constantly fatigued, and never really knowing why. So up until then, I had just had the chronic stomach issues, developed acid reflux, heartburn, really, really badly, to the point where almost every meal I felt like I was gonna vomit, like nausea all the time. I finally saw a GI doctor, a GI specialist, sorry. I had seen one as a child, but nothing really came of it. But as an adult, they started to look into celiac disease. And then ultimately I was diagnosed as a celiac for 8 years. And on a strict diet, I just wasn't getting better. And I kept going back and telling the doctors, I'm not getting better. And if the GI doctor wouldn't listen, I'd go to the family doctor and I'd tell her, I'm not getting better. And their answer was always, well, you must still be eating wheat, and I would tell them, I know my body, I'm the one who's with myself every day. I know I'm not eating wheat. I became very strict. My husband and my daughter also ate gluten-free at home. We were very strict to make sure that I was getting the best I could and get better, but I wasn't. And it wasn't until my third GI doctor that when he really looked into it and thought, maybe this isn't celiac disease. But before that third GI doctor, I eventually got to a point, acid reflux, stomach issues, all these things, where I had a wisdom teeth surgery, and I became very sick, and I was in the hospital, and ultimately they said I had something called ITP, and at the time I thought, what's that, who knows what ITP is? And ITP is, it's to do with the platelets and the white blood cells, and so I had a couple of rounds of IgG therapy, and got better, felt great, and the doctor said, well, actually, you don't have ITP because you recovered, so you're fine, you can go home, be with your family. And I was like, yay, it's all good, I'm good. So I went home, thinking, that's it, I recovered, this is fantastic. Now, keeping in mind, I forgot to mention that I always was sick with colds, sick with all these random weird staph infections, and things like that. So my whole life, just I forgot to mention that there was always, I was always usually sick, caught the flu every year, things like that. But yeah, so I went home from the ITP, feeling pretty good, fatigued as usual, stomach problems as always. That was just the norm. I accepted it. And then a couple years after the ITP episode, or the not ITP episode, I started to feel really strange. I just had a day where even just lifting my arm was incredibly hard for me to do, and I couldn't move, and the whites of my eyes turned yellow, and my urine turned almost like this deep orange, like coppery color. And I knew right away that something wasn't right. And when I went to the hospital and was sitting, when the nurse had talked to me in Emerge, they actually admitted me right away. And I knew in that moment, you know, something's not right here. Because usually you sit in the waiting room for a little while, quite a while, especially in Canada. But they whisked me right in, and within like the hour, I knew that I had hemolytic anemia, and that my body, basically hemolytic anemia, my body was attacking and destroying my red blood cells. So my hemoglobin actually got down to 50. I'm not sure if it's different in the US how what 50 equals to be, but for us in Canada, they just told me it was at 50, which is incredibly, incredibly low. And any lower than that is very high risk, and you can die. So I had, they took as much blood work as they could, and then I had blood transfusions. Then I was also put on steroids as well, prednisone. The prednisone made me feel great initially. You know, I was up and about. I was starving 24/7. So the first month was okay. You know, the prednisone made me feel good. My numbers went up. You know, I thought, okay, I can do this. But after about a month on the prednisone, all the side effects started to kick in. That giant list of side effects. And I have to say, I think I had about every side effect there was with prednisone, which was horrible. So the many good things it was doing for me, the bad things, you know, were just so much worse. And I began to pray that I would just be off the prednisone and never have to go on it again because it was horrible. And I was on it for about 5 months. And when they tapered me off of the prednisone, they stopped me at 10 milligrams. Usually they taper a lot slower, which is something I didn't realize because I didn't know much about the tapering process. They stopped me at 10. I became very sick, and I got something called adrenocrisis, which just meant they stopped it too soon for what my body could handle. And I was hospitalized again. I had to go back on the steroid, and then re-taper down to 1 milligram a day. So that worked well for me, and I was able to come off the steroids. Now, I had been dealing with alopecia areata for a little while, which was just hair loss in small little patches around my head, and sometimes some eyebrow hair loss. For me, it was traumatizing, but at the same time, I could hide the patches that I was losing. So I didn't really, I stressed about it, but I would just tell myself, you know, this is just for now. Once I get medicines and once the doctors find out what I have, you know, I'm gonna be okay. But once I came off those steroids after the 5.5 months, the hair started to dramatically fall out. I couldn't run my fingers through my hair without taking a patch, probably about that big of hair with it, you know, completely out. And the effect this had on me was just devastating. I mean, I would look at my husband and I would show him this giant pile of hair in my hands, and I would just have tears in my eyes, and I would be like, what is happening to me, you know? And I would go back to the doctors, and as long as my numbers were up, you know, and things like that, I was fine to them, you know. And I would go to the dermatologist, and she would start putting steroid injections into my scalp to try to help produce the hair. But I knew in my heart that these injections were just a mask for what was really happening, you know, and they didn't even really help in my case once the hair started to really fall out. So on top of all these other things, this ITP, this hemolytic anemia, which they lump together and call Evans syndrome. So if you've had ITP and you've had hemolytic anemia, you have Evans syndrome, which is what I was ultimately diagnosed with. But I still didn't really have any answers, because that's not really an answer, because they can't tell you why you got ITP or why you got Evans syndrome or why you have Evans syndrome. It's just you have it, but there's no reason, like they don't know why your body is doing this to itself. So ultimately I had that as an explanation, but I didn't have any answers. Then the hair started falling out dramatically after the steroid. And again, it was just like, well, it's alopecia. Well, what is it being caused? Again, why do I have alopecia? Well, we assume it's something to do with the immune system, but we don't know exactly what is causing it. So it was very frustrating. I became a hermit, essentially. You know, I wore pajamas and jogging pants and sweatshirts and toques for you Canadians out there. Lots of toques, you know, and hats and, you know, baseball caps. And I just became a recluse. I stayed indoors. You know, I would go to my parents, and that's pretty much it. I didn't want to be around people. And I remember thinking to myself, you know, that I wasn't a hermit. I kept thinking to myself, you know, I'm trying to stay pretty positive. I'm not a hermit. You know, I'm not depressed. I'm doing okay. And I would talk to my husband, and he would say, you know, Liz, I think you are having some issues with this. I mean, you never leave the house, you know. And when I started to break it down, I started to realize that I've always been a very strong-willed person. And how I would get through every step is I would just tell myself, okay, this is the worst. This part right now, this is the worst. It's not going to get any worse than this. And then a few weeks later, something worse would happen, you know, and I would just think to myself, oh God, okay, well, this is the worst. This is the worst. It's going to get better from here, so don't worry. And then it would get worse, you know, and slowly that chipped away at that strength that I had. And like I said, I became a hermit. I stayed home. You know, I was very emotional, but trying to hold it inside. I felt this tremendous guilt. I felt a guilt of like, everybody was watching me kind of decline, and everyone was watching me get sicker and look sicker, you know, and my husband had to like hold me when I cried from like tremendous stomach pain and joint pains. And I felt like such a burden, you know, and that, you know, I should be able to take care of myself and not be such a burden on everybody else in my life. And at that point, I really felt like that's what I was. So I was like, I need to be strong, and I need to feel strong. I need to look strong. That was the biggest thing. I need to appear like I'm the strongest person, and this doesn't bother me because I was so scared of hurting the people in my life. And I knew that if they could see that I was strong, that they would feel better, you know, and I felt this tremendous need to make sure that everybody around me felt good about it. And by showing that I felt good, they would feel good in turn. But as any disease or any illness, it just gets to a point where you want to stop fighting. You feel like, I can't do this anymore. And when I lost the hair, that was a really big point for me, because I would think to myself, you know, I'm not the person my husband married anymore. I don't look like the same person. You know, I have no hair, I have no eyebrows, I have no eyelashes. You know, I have this alopecia that who knows where it's coming from. And, you know, I started to realize and started to admit to myself that depression was just around the corner, and that I didn't think I could be strong anymore, and put up this front that I'm okay, you know, just for the sake of everybody else. And what I highly recommend to people, which is what I did, what I feel like really helped, was I started to admit to my family members, I'm in a bad place. You know, I would wake up and I would tell my husband, I don't think today is going to be a good day. I'm in a very bad place this morning. I need to just be. I need to do things for myself. I need to just lay in bed. You know, I started to realize that doing those things actually was helping me, admitting that I was feeling sad, that I was feeling depressed, you know, that I was feeling different. I didn't know who I was anymore. You know, that was so important for the healing process, you know. Eventually, I started to wear normal clothes again. And then doctors started to talk about this thing called CVID. And I remember being like, yeah, okay, CVID, sure, whatever. You know, I had gone my whole life since the age of 2. I'm 32 years old now without a diagnosis, and always being sick and feeling like a hypochondriac, whoever I spoke to. So for them to say, we think it's this thing called CVID, I thought, yeah, sure. And I remember the day that I went into my immunologist's office, and he told me, I know what you have. You have CVID, common variable immunodeficiency. And I just bawled. I just cried. going so long, never knowing, screaming out, feeling like you're screaming at everybody, like, I don't feel normal, something's wrong. And everybody just passing you to the next, or convincing you that there's really nothing wrong with you. You're just too stressed and too anxiety ridden to settle down. So for him to actually look at me and say, you have this, and there is a treatment, and I just sobbed. And I felt so bad for the doctor because I think he expected me to be like, yes, oh my goodness, and even though it was tremendous joy I was feeling, it came out in these tears, so I think he was kind of like, reaching for Kleenexes, fumbling, and I eventually said to him, I'm so sorry, this is joy, this is pure joy, because I have gone so long in my life just feeling like nobody would ever figure this out, and I would just be like literally moving at a snail's pace through life because I have no energy. And I remember just hugging my husband, who was a tremendous help to me through the entire process. I really don't know what I would have done without him. He was my advocate. He was my warrior, my soldier in this battle. He stood by me every step of the way. He was, stayed in the hospital with me for 14 days straight, slept in the little single bed next to me, every night. And he was there when the doctors would come in with his laptop, taking notes, and logging everything and researching at night, watching talks from doctors who knew about CVID and IP and all this, PI and all this. And I really don't know what I would have done without him. And I guess while I'm on that topic, finding that person in your life, it doesn't have to be a spouse. It can be a cousin, a sibling, a parent, really finding them and using them to help you, because there are so many people in your life that if you just asked, they'll be there for you every step of the way, And so now, as you can see, I've started wearing headscarves. I love playing with makeup and things like that. Style, I love shopping and clothing. And there was a point in my life where I never thought I would enjoy those things again, because when I looked in the mirror, I didn't recognize the person that was looking at me, and that really scared me. But as I started to crawl out of that hole, so I feel like I came to a crossroads at one point, and it was like one way led me to severe depression, and the other way just kind of led me to enlightenment and happiness. And how I think I describe it is, I got to that crossroads and I thought to myself, you can be depressed. It'd be all too easy to just fall into that pit of depression. Or I realized, I'm gonna go through this regardless. I've already lost my hair. Going into depression about it isn't gonna change that. If anything, it's gonna make it worse. It's gonna make me worse. It's gonna make me physically decline. And so in that moment, I found the strength to tell myself, you can do this. And you are beautiful as the person you are now, and you are strong, and it is not conceited or, weird to tell yourself that you are strong and beautiful and positive and that you can conquer anything. And I never thought I would get to that point in my life. I never thought that I could be bald, have no hair, and still look at myself and think I was beautiful, because I was at a point where I thought, how is anyone gonna see me as beautiful ever again? Or how am I gonna feel beautiful ever again? So to be at that crossroads and to make that final decision, like, no, this is my decision. And to be honest, it's true. You can have hundreds of people come up to you and tell you you're beautiful every day, but if you don't feel it, it's not gonna happen. And you can tell people, have people come up to you every day and say, don't worry, you don't have to be depressed. You have a great life. But unless you feel that inside, it's just not gonna happen. And I got to that point where I realized that, I have to accept myself with everything that I've gone through and move forward happy and accepting what is because I can't change it. I mean, I can move forward and do research and eat healthy, or, you know, try to figure things out to improve it, you know. But I just have to accept what is. And to be honest, I had one patch of hair left, and me and my husband went into the bathroom. He got his like razors and he shaved my head. And that was one of the most empowering moments of my life, because my worst fear was looking in a mirror and being bald. And when I think about it now, I'm like, how dumb is that? Your fear is being bald. Your fear should be being dead or losing a family member or not being with your family. That should be your fear. So when I was able to look at myself in a mirror, bald, face that fear, conquer it, then I thought, wow, this is my worst fear. I just faced it. And it's not bad at all, you know? It's not bad at all. And I think that some people see me now and they think, wow, Liz, like, you're so confident and you're so inspiring because you're so confident. How do you do it? Wow, it's amazing. And I love when people tell me that, because it only strengthens, you know, my core of what I feel. But at the same time, I just want everybody to know that's going through it, that you're probably not going to find that confidence right off the bat, and that I didn't. So when people see me and they see how confident and happy I am, I always like them to know that I went through the struggle first. You have to. You have to go through the process, you know, unfortunately, because I feel like that process is what brings you to the other side, you know, and helps you crawl out of that hole. And I feel like, truly, I guess not blessed that I was sick, but blessed that I was able to see a new perspective on my life. Because now when I look at life, I think, wow, look at the sky. Look at the clouds. Look at the ocean. Look at my family. Look at this spouse who loves me unconditionally, and this child that I have is so beautiful and perfect, and I brought her into this world. I think, wow, I'm so lucky to finally have this perspective on life that not a lot of people have, and they try so hard, but this falling and picking myself back up really helped me reach that point. And I'm so lucky to be here, to be at a point in my life where I'm strong and I'm courageous and I'm brave and I love myself the way I am, and I don't care about the stares and I don't care about the comments, and I'm just free. And I feel like every person that has an immunodeficiency or CVID or absolutely anything, actually, just even people with alopecia, you know, if you can get to that point and truly accept what is, you will do amazing in this life, because you know what? Living is the objective here. Just living and being happy with living. And I'm so happy that I've reached that point. And you know, I love when little girls come up to me and they say, do you have hair? And I say to them, no, I don't have hair. And they say, oh, wow. Well, why don't you have hair? And I say, well, you know, I was very sick. I lost my hair. I have something called alopecia. And they say, oh, wow, you know. And I love to tell them, see, people can be beautiful and happy no matter what happens to them in their life. And I feel like I'm showing that example to my daughter as well. And actually, she was a big part of this, I could say, as well, because she's only going to be 6 for 1 year. She's only going to be 7 for 1 year, 8, 9, 10, etc. I can't get any of those days back. I can never relive a year of her life. So I can live it depressed and miss everything, or I can just accept what is and be joyful and happy. And when my time comes, whenever that is, I can look back and be proud of myself and know that I lived my best life possible. And just back to the IDF and everything they do, it's been an incredible experience. Like I said, I didn't know about CVID or Evans syndrome or alopecia until I was directly affected by it. And I feel like that's most people in this world. But if you're watching this and you're someone who isn't directly affected by any of these things, but just like the message, consider being an advocate for this. Consider helping with the cause. There are so many rare diseases out there that don't get the acknowledgement that they need. And like I said, it's because people aren't directly affected by it. So it's not heard, it's not spread out there for people to know about. So whether you are someone affected by these issues or not, awareness is the number one thing to get treatments, to get the word out there, to get research, which is so important. So I guess in close, I just want to say that whether you're someone who's recently diagnosed, someone who thinks they may have this, a parent of a child, you think may have this, just anyone who doesn't even have any connection to any of these things, my main message is, no matter what comes, no matter what happens to you, don't wait for a personal disaster or a personal traumatic experience to change your life for the better. Because once you accept life and the things it throws at you and come out on the other side, then you can experience just life and all the amazing things that brings. And I wish everybody the healthiest, happiest life. Thank you so much. I wanted to mention something about the parents who have children who they suspect or who do have, a PI, who have PI. Because I'm the one directly affected by it, I've looked at my daughter and I think, thank God it's me. Thank God I'm the one that has this and not her. Because I don't think, it would definitely be worse for me to watch my child suffer through this than have me suffer through it. So I have this tremendous, just like my heart goes out to the parents with children who are going through this process. Me, having been a child who went through a lot of it, a lot of tests and a lot of hospitals and, all that stuff, I know the direct effect it can have on a child growing up. And as a child, we need that person who's going to be our soldier, our advocate, and I feel like educating a child about so many things, even just about healthy lifestyle, just anything that can benefit your health in general is so important, because then we grow up really being advocates for ourselves and learning how to take over that control and how we should speak to the doctors, what tests we should ask for. I feel like the role of a parent is so important, and it is so hard. But I think that someone needs to tell these parents that you are doing a tremendous job and that you are only making your child stronger, you are only giving them more confidence, and you are going to help them be a stronger adult, a strong, proud adult who's going to be able to take their care into their own hands and ask the right questions. And you are such an important part of the process of any child going through this. And like I said, I'm 32 years old, and when I had hit the hemolytic anemia and I was in the hospital, who was sitting next to me in the armchair? It was my mother. She sat 14 hours in the emergency room in a small little chair next to me. It doesn't matter how old that child gets. We may not always remember what you tell us, but we will always remember how you made us feel. And that is one of the most important things. And I never forget every time that my mother sat next to me during a procedure, or every time she held my hand or rubbed my back. So keep it up and remember that you are helping your child tremendously through this fight. And someday I really feel they could be where I'm sitting right now. And a lot of it has to do with you.